Hello, aspirants, and welcome to this explainer session by the expert faculty team at Rungta IAS Academy. Today, we are decoding a highly critical, high-yield topic for your General Studies Paper 2 preparation. The Ebola outbreak in Congo is making massive global headlines right now. But as serious UPSC aspirants, you know we have to look way past just the basic medical facts. We need to understand the broader global health governance perspective here. So let's dive right in. Let's start with our core analytical question. Why did the World Health Organization actually step in and declare this specific Congo Ebola outbreak a global emergency? You see, if a mains question asks you to evaluate this, you can't just give a surface-level summary. We really need to analyze the exact specific triggers that force an international declaration of this magnitude. Just consider the ground reality in cities like Goma right now. The situation is escalating very rapidly. Strict temperature checks and hospital protocols are now absolutely mandatory. And aspirants, kindly note the geography for your prelims mapping. The epicenter is in the eastern province of Ituri. It is absolutely crucial to mark Ituri and Goma on your maps tonight, so you understand exactly how these containment protocols are being enforced regionally. The severity of the situation is, well, it's quite alarming. We're currently looking at 88 deaths and over 300 suspected cases. And here's the catch. The World Health Organization reported that while Congo accounts for almost all of these, 2 isolated cases have already popped up in neighboring Uganda. This kind of cross-border spillover, that is a massive red flag for international health bodies. Which brings us directly to a prime GS Paper 2 concept, PHEIC, or Public Health Emergency of International Concern. By WHO standards, a PHEIC requires a specific triad of conditions. The event must be serious, it must carry a real risk of international spread, and it absolutely must demand a coordinated international response. Please keep this exact triad handy for your mains answers on global governance. All right, let's quickly break down the high-yield scientific specifics you'll need for your health syllabus notes. This particular outbreak is caused by the Bundibugyo virus. Health authorities confirm it's a rare, highly contagious variant of the Ebola disease spread via bodily fluids. It is severe, it's often fatal, and honestly, the most alarming part for global health authorities, there are currently absolutely no approved therapeutics or vaccines available for it. None. But what really makes this PHIC declaration so urgent is the alarming geographical jump. A laboratory-confirmed case has just been reported in Congo's capital, Kinshasa. Now visualize the map of Africa for a second. Kinshasa is roughly 1,000 kilometers away from the epicenter in Ituri. In a region with complex and often informal transport networks, a geographical leap of that magnitude makes contact tracing almost impossibly complex. Now, here is where it gets incredibly interesting for your policy analysis. Think back to a pandemic emergency like COVID-19. We all remember the widespread global lockdowns and strict border closures, right? Well, despite the PHEIC status of this Ebola outbreak, the WHO has explicitly advised against closing international borders. They state it doesn't meet pandemic criteria yet. This contrast is literally prime fodder for an essay or a mains answer debating global trade versus disease containment. To make your preparation absolutely foolproof, let's map these dimensions directly to your syllabus. You can use the WHO declaration to discuss global health governance. The lack of vaccines? That is a perfect case study for social sector and health management. And that open borders policy? A brilliant, real-world example to use in international relations. Jot this structure down, aspirants. It's going to deeply enrich your mains answers. To wrap up this explainer session, I want to leave you with a thought-provoking mock interview question. Should international borders remain open during severe, localized health emergencies? I want you to think critically about the economic survival of developing nations versus collective international health risks. Formulate your stand clearly. Thank you for joining us today, aspirants. Keep studying smart, stick to your syllabus, and all the very best for your preparation.